Those of us with diabetes know our care, it can be incredibly complex.
And now there's a new clinic in Edmonton to help simplify the process. Sue Lingo has that and more in today's Health Matters.
The new one-stop Edmonton Diabetes and High-Risk Foot Clinic just opened on May 1st. Since then, the team has seen more than 700 patients, many with the common complication of the disease, severe foot ulcers.
Hi George, how are you?
I'm superb, thank you very much.
George Pachoff is getting a medi-pedi today, a pedicure that's a cross between pampering and prevention.
There's one on the side.
Yeah.
It's opened up as well.
Okay.
George has type 2 diabetes, which damaged the nerves in his feet. He had no idea he had a serious wound under his big toe until his son showed him a photo of it.
You look at it, you're thinking, holy smokes, I can sort of see bone at the bottom of this.
If you can't feel your feet, then you don't know if you're injuring your feet. You don't make those subconscious adjustments when you're standing or when you're walking. You don't know if there's a nail in your footwear.
The new Edmonton Diabetes and High-Risk Foot Clinic brings diabetes experts together in one space. Specialists, foot care nurses, educators, a dietitian, and a counselor. Dr. Daniel Shafran came up with the idea after years of watching patients go from place to place for their complex care.
It made it very difficult for them, and it also poses challenges to us as their caregivers. So I tried to bring as many of these things together as possible under one roof.
Here, if a nurse notices a severe wound on a patient's foot, a doctor is just steps away. The clinic can also do casting if necessary. Dr. Shafran says another key part of care is counseling for the constant stress of managing blood sugar levels.
And that can lead to anxiety, it can lead to burnout. That impacts their results, it impacts their overall health.
Untreated diabetic foot ulcers can lead to amputation. George is grateful for the new clinic and the care that saved his toe.
As a patient, the one-stop thing is tremendous. You get service with the problem that you may have at the time that you have the problem.
Each year in the Edmonton area, there are about 250 diabetes-related lower limb amputations. Now, most of the services at that clinic are covered by Alberta Health. The pedicures and counseling may be covered by private insurance. Well, Health Minister Jean-Yves Duclos has announced an investment of $78 million towards 3 projects to help relieve the strain on Canada's healthcare system.
Today's announcement will help advance our commitment to support the recruitment and retention of our health workers. It will also help recognize the skills of workers trained abroad and support worker mobility so that qualified health professionals can practice their profession where and when it is most needed.
Almost $29 million will go towards establishing a national registry of physicians to enhance the mobility of doctors and to help facilitate redeployment during a crisis. Over $45 million has been allocated to strengthening team-based family medicine, and over $4 million will go towards addressing the shortage of medical laboratory technicians. The funding is aimed at solving a host of issues in Canada's healthcare system made worse by the pandemic, including worker burnout and declining staffing levels.
Health Matters is brought to you in part by Alberta Blue Cross. Whatever life brings, be ready for it.